Well, thanks very much, Fergus. I think the best answer I can give at the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment, but I can tell you that we are shifting heaven and earth to roll them out as fast as we can. I know that JVT, you've also been asked about this today. Is there anything you want to add on that?
I would add that actually it's probably not the best idea to look at December and how the NHS vaccination programme has started with the Pfizer vaccine and try and overlay that on kind of kitchen table mathematics for how that's going to scale up through January, February and March. There's a real game changer here in terms of the thermostability of the AZ vaccine being handleable at 2 to 8 degrees centigrade all the way through, none of this ultra low temperature, none of the thawing, and a months-long stability at 2 to 8 that is going to give us all sorts of reach and flexibility and scale up. In addition to that, there is an absolute ambition across the whole of the system that the only thing that is going to slow us down is batches of vaccine becoming available. And many of you know already that it's not just about vaccine manufacture, it's about fill and finish, which is a critically short resource across the globe, always has been for vaccines. And then there is individual batch release, which is a safety and quality requirement that absolutely has to take place. But I suspect Steve Powis can give you a bit more detail about how the NHS plans to scale up and how the primary care networks, for example, are raring to come on board.
Yes, thanks, Fergus. So as you know, we have been preparing for many months within the NHS to start this massive vaccination programme, the largest the NHS has ever undertaken. And we started that in December with the Pfizer vaccine rollout, which we knew would be based on limited supplies as we go towards the end of the year. And as you know, as of last Sunday, over 500,000 people had been vaccinated in the first few weeks. We now have the good news that the AstraZeneca vaccine has been approved, and our intention is to start rolling that out through hospital hubs and primary care networks beginning on the 4th of January, in other words, next Monday. And that will lead to a big expansion in the number of people who are vaccinated. And of course, with the other news that we are now permitted to space the second dose, as JVT has implied, as explained, that also means that we can get on and vaccinate more people. So our aim is to get the jab into people's arms as quickly as the manufacturers can supply that vaccine to us. We've been focusing, as you know, on the highest priority groups set by JCVI, so the over 80s, residents in care homes, care home workers, and to avoid wastage, we've also been vaccinating NHS staff. But the increased supply that comes with the AstraZeneca vaccine means that we have written out to healthcare organisations today to instruct them to immediately expand the vaccination programme to all frontline health and social care workers. And as vaccine supplies increase over the next few months, then we will be working to deploy through the next set of priority groups that JCVI have identified.